Hey everyone, and welcome back for another deep dive. Today we're going to be tackling a topic that one of you specifically requested, so thanks for sending that in.
Absolutely.
We're going to be talking about bipolar disorder.
Great topic.
Yeah, I'm excited to kind of dig into it. We've got some excerpts here from a really comprehensive guide, and
It's going to be good.
yeah, it's shaping up to be pretty interesting. So we want to really understand, what this actually is.
Right. And I think it's important for people to understand how it affects people's lives
Yeah,
and, also why it's so important. We all have a better understanding of it in general,
exactly.
more awareness.
Yeah, so the guide starts out by defining bipolar disorder as a mental health condition that's really marked by these extreme shifts in mood.
Right.
And it's important to emphasize here that, this isn't just like the normal ups and downs
Oh, absolutely not.
that we all experience, right?
This is far more intense,
Uh,
and much more disruptive to daily life.
yeah.
Imagine feeling completely on top of the world, full of energy, full of ideas, and then suddenly plummeting into, a really deep depression.
Yeah.
Where even the simplest tasks feel completely impossible.
Right.
That's the kind of reality
Yeah.
that we're talking about for millions of people.
Wow. That paints a really powerful picture. And you mentioned millions of people.
Yeah,
The guide actually points out that this is way more common than a lot of people realize,
it is.
affecting roughly 1–3% of the global population.
Yeah, that's a significant chunk of the population for sure.
Sure.
And it really highlights the need for us to have greater awareness
Yeah.
and understanding. I think it's also interesting to note that, the term manic depressive illness was used in the past.
Oh, right.
And some people listening might be
More familiar with that.
more familiar with that term.
Yeah, that's really helpful context.
Yeah.
So we've got this general idea of these, extreme mood swings.
Right.
But the guide goes on to explain that there are different types of bipolar disorder,
Yeah,
which I feel like is a really crucial point
it is.
because it means that not everyone experiences it in the same way.
Yeah, and that's actually really key
Okay.
for, diagnosis and treatment, being able to differentiate that.
Gotcha.
So, for example, you have bipolar,
Okay.
and this involves what are called full-blown manic episodes.
Okay.
They can last for a week or even longer,
Wow.
and they can be so intense they require hospitalization.
So we're talking really severe
Severe, yeah.
with bipolar.
Yeah.
And to clarify, when we're talking about mania, what exactly are we talking about?
Well, during a manic episode, someone with bipolar disorder might feel incredibly euphoric,
Okay.
like almost invincible. Their energy levels are through the roof.
Yeah.
And they might need very little sleep. Like someone might go days without feeling tired.
Wow. So it's really an extreme
It is.
shift in energy.
Yeah. And with all this energy often comes racing thoughts,
Oh, wow.
which can make it really difficult to focus or concentrate. And they might jump from one idea to the next, start a bunch of different projects, but never actually finish them.
Right.
And this kind of thinking can also lead to, impulsive behavior,
Right.
like spending excessive amounts of money,
Right.
reckless driving, or even engaging in other kinds of risky activities.
So even though there's this heightened energy and maybe even euphoria,
Yeah,
it can still become a negative
it can definitely.
experience with these impulsive behaviors.
Absolutely. It's a complex experience, and it's one where that initial, excitement and energy
Yeah.
can quickly become chaotic and potentially harmful.
Gotcha.
Yeah.
Okay, that makes a lot of sense. Now, we talked about hypomania in Bipolar II
Yeah.
being kind of a less intense version of mania.
Right.
So how does that difference actually play out in terms of symptoms?
So someone experiencing a hypomanic episode might feel very productive and creative.
Okay.
They might be more talkative, more social. Their thoughts might be flowing more quickly than usual. But unlike with mania, they're generally still able to function in their daily lives.
Okay.
They might even see it as a positive thing.
Right, so it's kind of a milder version of the manic symptoms.
It is.
And it might not be as disruptive to their life or to those around them.
Exactly.
Okay.
And it's important to note that hypomania can be really difficult to identify
Oh, okay.
because it can be mistaken for just, feeling good
Yeah.
or being in a really productive mood.
Right.
But recognizing it is really important
Okay.
because it can be an early warning sign of a potential shift
Gotcha.
into a more severe manic episode or even a depressive episode.
So recognizing these subtle shifts
Yeah.
in their mood and energy is super important for managing
Very important.
bipolar II.
It is. It's all about being attuned to those changes
Okay.
and knowing when to seek support or adjust treatment plans.
Gotcha. So we've talked about the manic side of things, both the mania and the hypomania. But now let's kind of shift gears and look at the other end of the spectrum, the depressive episode.
Yeah.
And the guide uses some pretty stark language to describe this part.
It does. It does.
Bipolar disorder.
Yeah, the depressive episodes can be incredibly debilitating.
Okay.
They're characterized by, really profound sadness, fatigue, and a loss of interest
Wow.
in things that once brought them joy. So, someone experiencing a depressive episode might struggle to get out of bed, have difficulty concentrating, and feel really hopeless or even worthless.
So it's such a stark contrast.
It is.
To that energy and drive.
Huge contrast.
Of a manic episode.
Exactly.
Yeah.
It's important to remember that these mood shifts
Yeah.
can be super dramatic.
Wow.
Going from one extreme to the other.
Right.
And so during a depressive episode, daily tasks can feel overwhelming.
Yeah.
Social interaction might be avoided.
Right.
Even basic self-care can become a struggle.
The guide also points out that, changes in appetite and sleep patterns are really common. Oh, yeah.
During these depressive episodes,
Absolutely.
some people might sleep excessively, while others struggle to get any rest.
Yeah, and unfortunately, thoughts of death or suicide can also occur during these episodes.
Wow.
So this is why, seeking professional help is absolutely critical.
Yeah.
It's not about snapping out of it, These are serious symptoms that need attention and care.
Absolutely. Knowing what to look for and when to seek help could be life-saving.
It really could.
Now, the guide goes on to talk about the causes of bipolar disorder.
Right.
And it seems like there's not just this one easy answer
No, not at all.
to this question.
It's a really complex interplay of factors.
Okay.
One of the major contributors is genetics.
Okay.
Family history plays a pretty significant role.
So if someone in your family has bipolar disorder...
Yeah, you're statistically more likely to develop it.
Gotcha. Okay, so genetics definitely have an influence.
They do.
Are there other factors that kind of play into this? Yeah, there are. Research suggests that there are biological differences in the brains of people with bipolar disorder.
So it's not just a matter of personality?
No.
Or willpower?
It's not.
There are actual physical...
there are actual physical differences
Wow.
in brain function at play.
Interesting. What kind of differences are we talking about?
Well, specifically, certain areas of the brain that are involved in regulating mood,
Okay.
like the prefrontal cortex and the amygdala, they show altered activity.
So we're getting a better understanding of these brain differences.
We are, but there's still a lot that we don't know.
Right.
It's a fascinating area of ongoing research.
That's amazing to think about all these intricate processes
I know, right?
happening in our brains.
Yeah.
The guide also mentions environmental factors.
Yes.
What are we talking about there?
Well, things like really severe stress, trauma, or even major life changes can act as triggers, especially for people who are already genetically predisposed to bipolar disorder. It's important to note that these factors don't cause bipolar disorder,
Right.
but they can influence the onset or the severity of episodes in those who are more vulnerable.
So it's like a combination of genetics and life experiences that create the conditions for it
Exactly.
to emerge.
It's very individualized.
Okay.
Different factors for different people.
Yeah, that makes a lot of sense. So speaking of diagnosis, how does someone actually get diagnosed with this?
Right.
The guide mentions that it involves a combination of evaluations
It does.
and assessments.
Yeah, it requires a really thorough evaluation by a mental health professional.
Okay.
This usually involves a clinical interview where they'll ask you about your symptoms, medical history, and family history of mental health conditions.
Okay.
And they may also use some psychological tests or questionnaires to help assess your mood and thought patterns.
So it's not like a simple blood test or
No.
brain scan?
No, it's much more nuanced than that.
Okay.
It relies on the expertise of a mental health professional, and it's important to remember that it may take time to get an accurate diagnosis.
Right.
Because bipolar disorder can sometimes be mistaken for other conditions.
Right.
So it's really crucial to be patient and work with a healthcare provider who specializes in mood disorders.
That makes a lot of sense.
Yeah.
So once someone is diagnosed, what are the treatment options? Because the guide really emphasizes that there is hope.
Absolutely.
And that there are effective ways to manage this.
Absolutely. And that's a super important message to convey to people, that there's hope and that there are things that you can do.
Right.
So there are several approaches to treatment.
Okay.
And it often involves a combination of medication, therapy, and lifestyle changes.
Okay, so let's break all that down.
Okay.
Starting with medication.
Okay.
What are some of the common medications that are used?
Well, mood stabilizers are often the cornerstone of treatment.
Okay.
Lithium's a classic example.
Okay.
And it's been used for decades to help stabilize mood and prevent both manic and depressive episodes.
So it helps to kind of level out those extremes.
Exactly. And then anticonvulsants, which were originally developed for epilepsy, have also been found to be effective mood stabilizers.
Oh, interesting.
For some individuals with bipolar disorder.
So that was kind of an unexpected benefit of those medications?
Yeah.
And then in some cases, antipsychotics might be prescribed?
They might, especially during acute manic episodes.
Okay.
Or if someone's experiencing psychosis.
Right.
And antidepressants might be used cautiously.
Okay.
Because sometimes they can actually trigger manic episodes.
Oh, wow.
In individuals with bipolar disorder.
So it's a delicate balance.
It is.
To kind of figure out.
It is. Finding the right medication, the right dosage.
Yeah.
Requires careful monitoring and, collaboration with a psychiatrist.
It sounds like it can be a process of trial and error sometimes.
It can.
But with patience and open communication with their doctor, a lot of people can find something that really
improves their quality of life.
Absolutely. Many people do.
Now, the guide also mentions psychotherapy.
Yes.
As a crucial part of treatment.
Very much so.
How does that work with medication to kind of manage bipolar disorder?
So therapy plays a really vital role in helping individuals understand their condition, identify triggers, and develop those coping mechanisms to manage their mood swings.
Right.
Cognitive behavioral therapy, or CBT, is a particularly effective approach.
And what does that focus on?
So CBT focuses on recognizing and changing negative thought patterns and behaviors that contribute to mood episodes.
So it's about giving them the tools to manage their condition on a day-to-day basis.
Exactly. It's about empowering them to take an active role in their treatment and recovery.
I like that.
Yeah.
The guide also mentions other types of therapy, too, like psychoeducation and family-focused therapy.
Yes. Psychoeducation provides individuals and their families with information about bipolar disorder,
which helps them understand the condition and its impact on their lives.
Right.
And then family-focused therapy aims to improve communication and support within the family unit.
So it's kind of a holistic approach.
It is.
To not just the individual, but how it affects everyone around them.
Exactly. And alongside medication and therapy, lifestyle changes can also play a huge role in managing bipolar disorder.
What kind of lifestyle changes are we talking about?
Well, establishing a regular sleep-wake cycle.
Okay, so like good sleep hygiene.
Exactly. Getting regular exercise.
Okay.
And eating a healthy diet.
It's a really simple thing.
Yeah, it's amazing what a difference it makes.
It can have a big impact.
Yeah, for some individuals, limiting or avoiding alcohol and drug use can also be crucial.
Because those can interfere with medication and trigger episodes.
Absolutely.
So it's really like a multifaceted approach.
It is. It's not about any one magic bullet. It's about a combination of strategies that work together to help individuals lead more fulfilling lives.
Now, one thing that the guide makes a point of is that bipolar disorder is a lifelong condition.
Right.
So what does that mean for someone who receives a diagnosis?
Well, it means that while there's no cure,
it
is a very manageable condition.
Okay.
With the right treatment and support, people with bipolar disorder can lead full and productive lives.
That's a really important message of hope, right?
It is, yeah.
It's not a life sentence.
It's not.
It's something that you can manage.
It is.
And still live a good life.
Absolutely.
So early intervention and ongoing care are really crucial.
They're key.
For the best outcome.
Absolutely. The sooner someone receives a diagnosis and begins treatment, the better their chances of, managing their symptoms effectively.
Right.
And living a really fulfilling life.
So it's about seeking help early.
Yes.
And continuing that treatment over the long term.
Yes, absolutely.
That makes a lot of sense.
Yeah.
So we've explored these different types of bipolar disorder.
We have.
We've talked about the symptoms, the causes, the treatments.
Yeah.
But I think it's really crucial to circle back to something we talked about at the beginning. The idea that there's always more to learn.
Absolutely. This is just, a foundational understanding.
Right, the tip of the iceberg.
Yeah. Exactly.
And that's the beauty of learning, right? There's always more to explore, there's more to discover, more to understand, especially when it comes to mental health.
Absolutely. And, our understanding of bipolar disorder is constantly evolving.
Right.
There's new research emerging all the time.
So for someone who wants to continue learning about this and stay informed, what advice would you give them?
Well, there are so many resources available, reputable websites like the National Institute of Mental Health and the National Alliance on Mental Illness. They provide tons of information. There's research findings, support resources, and even personal stories from individuals living with bipolar disorder.
Yeah, and don't underestimate those personal stories.
Oh, absolutely.
Because hearing from someone who's actually going through it,
it's so powerful.
Can be super insightful.
For sure.
And inspiring.
Absolutely. And then if someone's looking for more in-depth information, they can always reach out to mental health organizations, support groups, or universities that have research programs focused on bipolar disorder.
Awesome.
Yeah, there's a lot out there.
So it's about being curious.
Yes.
Open to learning.
Absolutely.
And willing to seek out that information from credible sources.
Exactly. And remember, knowledge is power.
Right.
The more we understand about bipolar disorder, the better equipped we are to challenge stigma, advocate for better care, and support those who are struggling.
Absolutely.
So as we wrap up this first part of our deep dive into bipolar disorder, we want to leave you with a final thought to consider.
Okay.
We focused a lot on the individual experience of bipolar disorder, which is super important.
Yeah.
But let's zoom out for a second and consider the bigger picture. How can we create communities that are truly inclusive and supportive of people living with these conditions?
That's a big question.
It is. It is. And how can we make mental health care more accessible and affordable for everybody?
Yeah, that's another big one.
These are big questions, and there are no easy answers.
Right.
But there are questions worth thinking about and discussing and taking action on.
Yeah.
Because ultimately, creating a more just and compassionate world for those living with bipolar disorder and all mental health conditions is a goal worth striving for.
For sure.
So that's a wrap for part 1 of our deep dive into bipolar disorder.
We hope you found this first part insightful.
Yeah, and informative.
And maybe even a little bit inspiring.
Absolutely. Remember, you are not alone on this journey.
And we'll be back soon with part 2 to dive even deeper into this really important topic.
We'll see you then.
See ya.
The guide really gets into, what a manic episode can feel like. And it's important to understand that we're not talking about just feeling happy or energetic.
Right, it's got to be more than that.
Yeah, it's way more intense.
Yeah.
During a manic episode, someone might feel euphoric, like almost invincible.
Wow.
Their energy levels are through the roof. They might need very little sleep, like going days without feeling tired.
So it's a really extreme shift in energy levels.
It really is.
Yeah.
And often with this energy comes racing thoughts. Makes it hard to focus or concentrate.
Yeah.
They might jump from one idea to the next. Starting a million projects, but never finishing any of them.
Right.
And this can lead to impulsive behaviors, like excessive spending, reckless driving, or even engaging in other risky activities.
So even though there's all this energy and maybe even euphoria, it can still be kind of a negative experience?
Oh, yeah, for sure.
Those impulsive behaviors?
Definitely. It's a complex experience. That initial, excitement and energy can turn into something chaotic and potentially harmful.
Right. That makes a lot of sense. Now, we talked about hypomania in Bipolar II being a less intense version of mania.
Right.
So how does that difference play out in the symptoms?
Well, someone experiencing a hypomanic episode might feel super productive and creative.
Okay.
They might be more talkative, more social, and their thoughts might be going more quickly than usual.
Okay.
But unlike mania, they're generally still able to function in their daily lives.
Okay.
They might even see it as a good thing.
Right. So it's almost like a milder version of the manic symptoms.
Exactly.
And it might not be as disruptive to them or other people.
And it's important to note that hypomania can actually be kind of difficult to identify.
Oh, really?
Yeah, because it's easy to mistake it for just feeling good.
Yeah.
Or being in a really productive mood.
Right.
But recognizing it is really important.
Okay.
Because it can be like an early warning sign of a potential shift into a more severe manic episode or even a depressive episode.
So being able to recognize those subtle shifts is really important.
Super important.
For managing bipolar II.
Absolutely. You want to be attuned to those changes and, when to seek support or adjust treatment plans.
Right. Okay, so we've talked about the manic side of things, both mania and hypomania.
Right.
Now let's look at the other side, the depressive episode. The guide uses some pretty stark language to describe this part.
It does. The depressive episodes can be incredibly debilitating.
Wow.
They're characterized by profound sadness, fatigue, a loss of interest in things that once brought them joy.
Wow.
Someone experiencing a depressive episode might struggle to even get out of bed, have difficulty concentrating, feel hopeless or worthless.
So it really is like a complete shift.
It is. A huge contrast.
From that manic energy.
It really is. Yeah. It's like a night and day difference.
Yeah.
And it's important to remember that those mood shifts can be super dramatic.
Yeah.
Going from one extreme to the other.
Wow.
And during a depressive episode, daily tasks can feel totally overwhelming.
Yeah.
Social interaction might be avoided.
Right.
Even basic self-care can become a real struggle.
And the guy points out that changes in appetite and sleep are common, too.
Absolutely.
Like some people might sleep way too much, while others can't sleep.
Right. And sadly, thoughts of death or suicide can also occur during these episodes.
Wow.
Which is why seeking professional help is just so critical.
Absolutely.
It's not about snapping out of it, you know?
Right.
These are serious symptoms that need to be addressed.
Yeah. Knowing what to look for and when to get help can really be life-saving.
Absolutely.
It can be. Now, the guide talks about the causes of bipolar disorder.
Right.
And it seems like there's no simple answer.
There isn't. It's a super complex interplay of factors.
Okay.
One of the major things that contributes to it, though, is genetics.
Okay.
Family history plays a big role.
Okay. So if someone in your family has bipolar disorder...
Yeah, you're statistically more likely to develop it, too.
Okay. So genetics is a big one. Are there other factors at play?
Yeah. Research suggests that there are actual biological differences in the brains of people with bipolar disorder.
Interesting. So it's not just a matter of, like, personality or willpower. It's actual physical differences.
Yeah. Physical differences in brain function are at play.
What kind of differences?
Well, certain areas of the brain, like the prefrontal cortex and the amygdala, those are involved in regulating mood.
Yeah.
And they show altered activity.
So we're learning more about these differences.
We are. But there's still a lot we don't know.
Right.
It's a fascinating area of research.
It is. It really is. The guide also mentions environmental factors playing a role. So what are we talking about there?
Well, things like really severe stress trauma or even major life changes.
Okay.
Those can act as triggers, especially for people who are already genetically predisposed to bipolar disorder. And it's really important to note that these environmental factors don't actually cause bipolar disorder.
Okay.
But they can influence, when it starts or how severe it is.
Right. So it's almost like this combination of your genes and your life experiences that can create the right conditions.
Yeah. And that's why it's so important to have a comprehensive approach to diagnosis and treatment. It's not a one-size-fits-all condition.
So speaking of diagnosis, how does someone actually get diagnosed? The guide mentions evaluations and assessments.
Yeah, diagnosing bipolar disorder really requires a thorough evaluation by a mental health professional.
Okay.
And this usually involves a clinical interview where they'll ask about your symptoms, medical history, family history of mental health conditions. And they might also use psychological tests or questionnaires to kind of assess your mood and thought patterns.
So there's no easy test, like a blood test or a brain scan?
No. It's a lot more nuanced than that.
Gotcha.
It relies heavily on that mental health professional's expertise.
Right. And it can take some time to get an accurate diagnosis.
It can, because sometimes it's mistaken for other conditions.
Right.
So you really got to be patient and work with a healthcare provider who specializes in these types of disorders.
Yeah. Okay. That makes sense. So once someone is diagnosed, what are the options for treatment? And the guide makes a point of emphasizing that there is hope.
There is.
And that there are effective ways to manage this.
Absolutely. That's a really important message for people to hear, that there is hope and there are things you can do.
Right.
There are several approaches to treatment.
Okay.
And usually it involves a combination of things like medication therapy and lifestyle changes.
Okay. Let's break those down.
Okay.
Starting with medication. What are some of the common medications?
Well, mood stabilizers are often a cornerstone.
Okay.
Lithium is a classic example.
Okay.
It's been used for decades to help stabilize moods and prevent both manic and depressive episodes.
So it kind of levels out those extreme highs and lows.
Exactly.
Yeah.
And then you've got anticonvulsants, which were originally developed for epilepsy.
Yeah. Oh, wow.
But they've also been found to be effective mood stabilizers.
Interesting. So that was an unexpected benefit.
Yeah. For some people with bipolar disorder, and then in some cases, antipsychotic medications might be prescribed.
Okay. When would that be?
Well, especially during acute manic episodes.
Okay.
Or if psychosis is present.
Gotcha.
And then antidepressants are sometimes used, but very cautiously.
Okay. Why is that?
Because they can sometimes trigger manic episodes.
Oh, wow.
In people with bipolar disorder, so it's a delicate balance.
Yeah, to figure out the right combination.
It is. Finding the right medication and dosage requires really careful monitoring.
Right.
And a close collaboration with the psychiatrist.
Yeah, it sounds like it can be a process of trial and error.
It can be. Yeah. But with patience and open communication, people can usually find medications that really help improve their lives.
Awesome. Now, the guide also mentions psychotherapy as being a crucial part of treatment.
It's really important.
So how does therapy help to manage bipolar disorder along with medication?
Therapy is vital in helping people understand their condition, identify their triggers, and develop coping mechanisms to manage those mood swings. One really effective type of therapy is called cognitive behavioral therapy.
CBT.
Or CBT, yes.
And what does that focus on?
Well, CBT focuses on recognizing and changing negative thought patterns and behaviors that contribute to the mood episodes.
So it's kind of like giving them tools to manage those day-to-day challenges.
Exactly. It's about empowering them to be active participants in their treatment and recovery.
That's awesome. Now, the guide mentions other types of therapy, too, like psychoeducation and family-focused therapy.
Right. So psychoeducation is all about providing information about bipolar disorder to both the individuals and their families, so they can really understand the condition and how it affects their lives. And then family-focused therapy aims to improve communication and support within the family.
Right, so it's taking a more holistic approach.
It is.
And looking at how it affects not just the individual.
Yeah, the whole support system.
But the people around them, too.
Exactly. And in addition to medication and therapy, lifestyle changes can also make a big difference.
So what are some examples?
Well, establishing a regular sleep-wake cycle. Getting regular exercise.
So good sleep hygiene.
Yeah, exactly.
And getting enough exercise.
Right. And eating a healthy diet.
Sometimes those simple things can be really powerful.
Yeah, they can make a big difference. And for some individuals, limiting or avoiding alcohol and drugs is important, too.
Right, because those can interact with medications. And potentially trigger episodes. So it really is like a multifaceted approach.
It is. It's not about finding one magic cure-all.
Right.
It's about using a combination of strategies that work together to help people live more fulfilling lives.
One thing that the guide points out is that bipolar disorder is a lifelong condition. Right.
So what does that mean for someone who's diagnosed?
Well, it means that while there's no cure,
it
is a manageable condition. And with the right treatment and support, people with bipolar disorder can still live full and productive lives.
Yeah. That's a really important message.
It is.
Yeah, of hope.
It is. It's not a life sentence.
Right.
It's about managing it and living a good life.
Yeah. So early intervention is key.
It's key. The sooner someone is diagnosed and starts treatment,
Yeah.
the better their chances of being able to manage their symptoms and live a really fulfilling life.
So seeking help early and sticking with that treatment over the long term
That's so important.
is really crucial
It is.
for the best possible outcome.
It really is.
So we've covered a ton of ground here talking about bipolar disorder. We've explored the different types, the symptoms, the causes, and the many treatment options.
We have. It's a lot to take in.
It is. And like we've mentioned before, this is really just the beginning. There's always more to learn.
Yeah.
Absolutely. And one area that you might find really fascinating is the latest research on bipolar disorder.
Yeah, what's going on there?
Well, scientists are constantly making new discoveries about the brain genetics and the effectiveness of different treatments. So there's always something new to learn.
What are some of the things that are kind of coming up right now?
Well, for example, researchers are looking into personalized medicine, which is all about tailoring treatment plans to an individual's specific genetic makeup and symptoms.
Wow, so it's really individualized.
Exactly. It's super exciting, and it holds a lot of promise for improving outcomes.
Yeah, that sounds like the future of mental health care.
It really does. And there's also a growing interest in how lifestyle factors like diet and exercise can play a role.
Oh, interesting.
In managing bipolar disorder.
Yeah.
Some studies are showing that certain diets or regular physical activity can have a positive impact on mood and well-being.
So it's not just about medication and therapy.
Right. It's about looking at the whole picture.
Yeah, taking a more holistic approach.
Exactly. And it really emphasizes that we have more control than we think when it comes to our mental health.
I like that. And what about technology? Is that playing a role in this at all?
Absolutely. Digital technology is becoming increasingly important in both understanding and treating bipolar disorder.
How so?
Well, think about things like smartphone apps that track mood swings, sleep patterns, and even medication adherence.
Okay.
These tools can give us valuable data to help individuals and their doctors make better treatment decisions.
So technology is helping us learn more.
It is. And there are even apps being developed that use artificial intelligence.
Wow.
To analyze things like speech patterns and social media activity.
Interesting.
To detect early warning signs of mood episodes.
That's amazing. So we can potentially intervene earlier.
Exactly. It's all about early intervention and personalized care.
That's really cool. So for anyone listening who wants to learn more about this, where would you recommend they start?
I always recommend starting with reputable sources like the National Institute of Mental Health or the National Alliance on Mental Illness. Their websites have tons of information. They provide access to research findings, support resources, and personal stories from people with bipolar disorder.
And those personal stories can be really powerful.
They are. And don't forget about books.
Right.
There's some amazing books written by experts as well as memoirs that give you really valuable insights.
And for those who prefer something more visual, documentaries and TED Talks can be a great way to learn.
Absolutely. And if you're looking for more of a community or support, there are online forums and support groups where you can connect with others who really understand what you're going through.
Right. So you're not alone in this.
You're definitely not alone. There's a whole community of people who are committed to raising awareness, reducing stigma, and supporting those affected by bipolar disorder.
That's awesome. So as we wrap up our deep dive today, we want to leave you with one final thought to ponder.
Okay.
We've talked a lot about the science, the treatments, the challenges, but at the end of the day, people with bipolar disorder are just that.
Exactly.
They have hopes and dreams and aspirations.
Absolutely.
And they want to live fulfilling lives just like everyone else.
And it's up to all of us to create a world where they feel supported, understood, and empowered to do just that.
Couldn't have said it better myself. So let's continue to learn, to challenge our assumptions, and to advocate for a more inclusive and compassionate world for everyone.
Regardless of their mental health.
Exactly. Well, that wraps up our deep dive into bipolar disorder. We hope you learned something.
And that you found it valuable.
Stay curious out there.
Absolutely. Stay informed.
And most importantly,
stay well.